that you are tuning in today with having a coffee with Dr. Munné. Another amazing Friday, Dr. Munné.
I know.
Great seeing you. It's a good time always to share some wisdom with someone who's knowledgeable in the industry and wants the best of you for a healthy smile. And we're going to get to the content of today, an amazing topic that we're going to follow up on this series implant dentures. And we're going to have Dr. Munné show us some cases. For some of you that are connected on TikTok, please head over to our Munné DDS YouTube. And also, we're connected on Facebook and different in Instagram as well. And of course, the TikTokers that are watching us, we just want to thank you. Follow us, like us, leave your comments below. They mean the world to us, actually,
Yes.
to just know what topics you want us to talk next, or what specific questions you have. We're going to do our best to go and get to those questions. So without any more content to say on my end, I will leave to you to Dr. Munné. Thank you, Dr. Munné.
Thank you. Good morning,
Good
Adrian.
morning.
Good morning, everyone. And thank you so much for coming and tuning us this wonderful day here in Houston, Texas. We have the Houston Rodeo going on. And for those rodeo goers, have fun, enjoy yourselves. And for those that you're not in Houston, just come and see us in Houston. It's a wonderful celebration. And of course, you can always come visit us in our office. And today we want to continue with this topic of the implant dentures. We have been presenting like a case every week to just show you the potential and the possibilities of what's offering to patients these days, and what science and dentistry has wonderful technology. And I think that we can take care of a lot of difficult cases. And the case that I want to present to you is the case of a gentleman, and we're going to be posting the images on the screen.
Yes, before and
Adrian.
after. Yes.
Thank you. So let's just start posting the first one. I want to show you this patient that came to the office with a lot of infection. So you have here the before and after. But if you look at your image on the left side, patient had a lot of missing teeth, had a partial denture. That means like a mini denture that was filling up all the gaps of all these areas that didn't have teeth, but had lost a lot of bone. You can see that on the front area where there's missing teeth, the bone is very thin. And on the back, we can see the side views now. Adrian, just show me one side view. This patient had a lot of decay. Look at the image on your left. There was a lot of decay. There was actually a lot of infection. And when we have cases that there's infection ongoing, sometimes it's not possible to place the implants at the same time. This is a case that I wanted to illustrate, because we did a combination of an implant denture on the top, and then we were able to save the patient's front teeth, and we had implant bridges on the bottom back teeth. So that gives the availability for the patient to still feel, because they have teeth on the front, on the bottom, they still can have that, those receptors that when you close your mouth, it tells you, so much, because you feel it on your bone. And I always like to keep those feelings and those sensations for the patient when possible. Since we were able to save those teeth, we treated them. And then on the top, on the maxilla, the top area, we were able to place implants to do the denture the same day. But actually, all the implants did not go in at one time. So we want to look at the photo on the left side now. We're going to look at the left side of the patient. We're going to go to the next slide. And on the left side, you can see that there was a lot of infection on the back tooth. That's the tooth on the very back right of the patient. And that area had to be grafted with bone and drained all the infection. And there was not enough bone to really hold an implant, because there's also the sinus there. So we had to add bone in the sinus. So sometimes we have what's called a transitional denture. So we're able to just go ahead and place temporary denture with some implants. And then on the second surgery, once that area has already healed, then we're able to add more implants. Now, the patient never goes without teeth. So from the first surgery, we already added the denture.
That's amazing.
And, dentures, we go sometimes through transitions, so temporary dentures that help us with the healing, also help with the refining the bite of the patient, the tissues, conform the muscles, make sure that the patient feels really comfortable. And those phases are really important. And when we're talking about implant dentures, I want to also talk about a myth that sometimes there's some advertising out there that it makes you look like you go there one day and you walk out with teeth and that's it. You don't have to go to a dental office anymore. And that's not really, true like that. I mean, some patients are able to have all the implants on one day and only have one surgery. They probably have two dentures. The transitional denture, that is the denture that we place during the healing phase. That denture is not the final denture, but it can be actually wear for a long time. And then there's the final denture. That will be a denture, sometimes similar material, but more durable, or a complete different material like porcelain, or porcelain with some metal frame underneath. But those dentures are done later on. Even if the patient decides on doing a denture that's similar to the resin, that is the material used for the first time, as just a type of resin called PMMA, that kind of transitional denture, which might be used, as I mentioned, for extended period of time, let's say a year, 6 months, it depends on the case, it's still at one point going to need to be changed. And it's because that first denture is just to allow the patient to heal, to make sure that we get the soft tissue, the gum tissue conform to that denture, that we work out the bite, and that we, get to refine all the elements that are going to make that patient successful with the final denture. Now, the reason why I wanted to show this case is because, number one, there's a lot of different kinds of dentistry here, right? So we do have implant bridges on the bottom posterior teeth. We did periodontal treatment in the front teeth on the bottom, and just get those teeth healthy. You can see that the tissues on the bottom now look very healthy, look pink, look firm. The patient also was educated and got, a lot of learning about how to care for himself. So now the patient knows what to do, and does it. So always we want to empower the patient to understand what's necessary to maintain health. And although, unfortunately lost all his teeth on the top, but we're able to maintain some on the bottom. But with dental implants, we give the patient the possibility to having, a third set of teeth that we want to this time, not lose them and be something that's going to be long term, and that the patient can carry with them for the rest of their days, and enjoy. And this patient now is, from the functionality, from aesthetics, from the confidence standpoint, the comfort, from everything, it has been like a 360 transformation.
That's
And let's
amazing.
just go at the very end image, but just to show you that coming from a situation so precarious, sometimes patients think, well, there's no really solution for me. This is very terrible. I have a lot of decay. There's infection. There's pus. Teeth were loose, broken at the gum level. But actually, we're able, even if you look at the bite, you can see that the upper tooth that was left, it was at an angle. It was even inside the bottom tooth, but we were able to correct all that. We were able to help the patient achieve, like, an ideal situation, according to the point that they're at, on something that is gonna gives them possibility to chew, for them to be comfortable socially, but also the everyday, right? And just your meals, having your teeth, and how you feel about
It makes a
yourself.
difference.
Yeah, it makes a complete difference. But also, I wanted to emphasize the point that, even if it says teeth on a day, the marketing, be aware that every patient situation is different. In our practice, we don't treat every patient the same. Every case is unique. Every patient has unique circumstances. Every patient has unique, but we make all those options, you know, so the patient can afford them. So they're quality treatments that we make sure that they're successful, that the patient really undergoes everything, and everything was successful the first time. Nothing had to be redone. But we carry the patient to the end line, guaranteeing a success and making sure that the patient is going to, carry that and also have the knowledge on how to maintain it. And of course, this patient comes for cleanings regularly because that's going to be very important. Patient that has lost their teeth, they're high risk. Now they have, high value treatment in their mouth that needs to be maintained, and those maintenance appointments, those cleaning appointments are key to the success. So it's very important that you keep your cleaning appointments. I know that sometimes there's not enough emphasis or importance giving to those appointments, and they're treated more like, I don't really even know why I'm going. But that appointment is really what is the true prevention. And true prevention is when we actually can eliminate the disease completely. In order to do that, we need to eliminate what causes the disease, which is the bacteria. And remember that although you brush, and you might be able to brushing more very thoroughly, but you will not be able to sterilize your mouth and remove all the bacteria 100%. So things are going to hide, and you need to have a professional, a hygienist, or a doctor, whoever's doing your cleaning, to clean it professionally, so you actually can start on a clean slate. And every 2 3 months, 6 months, 4 months, whatever interval is ideal for you, every time you go, you don't have disease. That's the true prevention. When every time you go there's nothing to do, that means that the prevention is working. Now if you go and there's always problems, then that prevention is not correct. Then you need to brush more, you need to go more often, something needs to be adjusted. But the two prevention is like when every time you go to the dentist, you don't have any more needs. And that's what we're trying to keep our patients. Find the correct interval for them that they can, do their, home care at home, clean their teeth, and we give them the tools and then show them. And every time they come to the office, they're healthy. Now that patient can carry for the rest of their lives without needing any more dental treatment. There's nothing more beautiful than that. Help
Yes.
patients be healthy.
It is so valuable. And thank you, Dr. Munné, for sharing all this information. As you saw the images, the before and after, we're going to post those before and after so you can understand the level of excellence that we bring to the table in this practice. And just want to say, please leave your comments below. Do not forget to follow us on Facebook, Instagram, YouTube, and TikTok. We post content constantly throughout the week, and we keep you informed. Do not forget to leave your comments and everything, and like us on all these channels. It means a lot. It means the world when you leave a comment and everything. If you want to know more about us, about this practice, go to healthygums4 number 4 all.com to know more about our contact information and everything that you might need for your dental health. And we'll see you next time. Thank you so much, Dr. Renee.
Thank you, everyone.